Imagine this. Someone right in front of you suddenly collapses. What you do in the next few seconds, well, it could literally be the difference between life and death. In this explainer, we're not just going to list the steps of basic life support. We're going to get into the critical why behind the latest life-saving protocols. So let's dive right in. So what's your first instinct? Check their breathing, try to open their airway. For years, that's exactly what we were taught. But in a sudden cardiac arrest, it turns out the single most critical first step is something else entirely. Yeah, the modern approach pretty much flips all that old wisdom on its head. And understanding this one simple shift is honestly the key to saving a life. And that brings us right to the core principle. We've moved away from the traditional ABCs of resuscitation to a new, way more urgent sequence. It's all about one thing: getting the blood moving again, and doing it fast. Here it is, side by side. We used to be taught airway, then breathing, then circulation. Now, it's CAB, circulation, airway, and breathing. So the big takeaway is we start with chest compressions before we do anything else. But why the change? And this slide tells you everything you need to know. When the heart stops, it's like a total power outage for the body. There's still oxygen left in the blood, but the delivery truck, the circulation, has broken down. Every single second you waste on anything other than restarting that delivery service with chest compressions is a second the brain is literally being starved of oxygen. Okay, so we get the why. That makes sense. Now let's get into the how. Let's see how all of this builds into a practical, step-by-step action plan you can actually follow in an emergency. All right, step 1, check if they're responsive. You tap their shoulders and you shout, "Are you okay?" If you get nothing, you immediately call for help. Now, step 2 is a really rapid 10-second check for breathing and a pulse. But listen, 10 seconds is the absolute maximum. If you don't feel a pulse, or heck, if you're even a little bit unsure, you go straight to step 3 and you start CPR. Let this one sink in for a second, because it's huge. Hesitation is your absolute worst enemy here. The official guidelines couldn't be simpler. If you are in doubt, you start compressions. Why? Because the harm of delaying CPR on a heart that is actually stopped is infinitely greater than the harm of doing it on one that hasn't. So starting CPR is one thing, but doing it well, that's what really, truly makes a difference. So let's get into the nitty-gritty techniques that define effective, life-saving chest compressions. I really can't overstate this. Of everything we can possibly do, giving breaths, giving drugs, you name it, the quality of your chest compressions has the single biggest impact on whether someone survives. It is the engine of resuscitation. So what does high quality even mean? Well, first, we're talking about rate. You're aiming for 100 to 120 compressions every minute. The classic trick, of course, is to match the beat of Staying Alive by the Bee Gees. Just get that rhythm going in your head and push hard and push fast. Next up is depth. For an adult, you need to push down on the chest at least 5 to 6 centimeters. That's about 2 to 2.4 inches. This is what it takes to actually squeeze the heart and force that blood out to the body and, most importantly, to the brain. And finally, here are the details that really matter. Place the heel of your hand right in the center of the chest. After every single push, you have to let the chest fully recoil, come all the way back up. This is so critical. Think of it like letting a sponge expand to soak up water. That recoil is what lets the heart refill with blood. And, of course, minimize interruptions at all costs, and you stick to a strict 30-to-2 ratio. That's 30 compressions, then 2 breaths. Now, while CPR is happening, 2 other things need to come into play. We need a way to potentially hit the reset button on the heart's electrical system, and we need to start thinking like detectives to figure out what caused the whole thing in the first place. This is a massive priority. An automated external defibrillator, or an AED, can analyze the heart's rhythm and deliver a life-saving electrical shock if it's needed. The sooner that thing is on the patient, the better their chances are, period. But a defibrillator isn't some kind of magic bullet. It only works on what we call shockable rhythms. That's when the heart's electrical system is chaotic, but it's not totally dead, like in ventricular fibrillation. It can't restart a heart that's flatlined. For those non-shockable rhythms, the only tool we have is continuous, high-quality CPR to keep blood flowing while we hunt for that underlying cause. Okay, so the CPR is ongoing, the defibrillator is attached, but our job isn't done. The mechanics are just buying time. We have to ask the most important question of all to really solve the problem. This, right here, this is the whole ballgame.
CPR is a bridge to keep the patient alive, but unless we figure out and actually fix what caused the arrest, all our efforts might be for nothing. We have to be thinking about this from the second we start.
And to help us think through that why, there's a really handy mnemonic that guides our search for these reversible causes. It's known as the H's and T's. And here they are. This is basically a medical detective's checklist. We're looking for things like hypoxia, a lack of oxygen, or hypovolemia, major blood or fluid loss. Maybe it's an electrolyte issue like high potassium, which is hyperkalemia. On the T side, we check for things like a collapsed lung, a tension pneumothorax, or fluid around the heart, which is tamponade. Maybe it's toxins from an overdose, or a thrombosis, a big blood clot in the lungs or heart. Every one of these can be treated, but you have to find it first.
This quote just nails it. CPR and treating the cause have to go hand in hand. While one person is on the chest doing compressions, the rest of the team should be frantically working to diagnose and treat one of these H's and T's. That is how you get a good outcome.
Okay, we've covered a lot of ground here, so let's bring it all together and just hammer home the absolute must-know rules for responding to a cardiac arrest. These are your key takeaways. All right, let's lock in these 5 critical rules. 1, circulation first. It's CAB, not ABC. Got it? 2, start compressions within 10 seconds of figuring out someone's in arrest. 3, do not spend more than 10 seconds trying to find a pulse. If you're not sure, just start. 4, high-quality CPR is what saves the brain. Push hard, push fast. And 5, get that defibrillator on as soon as humanly possible. These 5 actions right here are the bedrock of saving a life. Mastering basic life support is the absolute foundation. But what happens before the collapse? In our next explainer, we're going to dive deep into recognizing the subtle signs of impending airway failure so you can intervene before someone even hits the ground. Thanks for joining us.